Hello, how you doing? Sorry, I have my 2-year-old with me because my wife is sleeping right now. She worked a double and she will kill me if I wake her up. So, bear with me. I will try to ignore everything else that's going on right now. Let's jump right into it. Diagnosis 309.81 F310 post-traumatic stress disorder, PTSD for Jake Levy. Z code Z62820, parent-child relational problem. Z63.0, relationship distress with spouse or intimate partner. Z56.9, other problem related to employment. Z56.82, problem related to it died. We're back. Current military deployment status, exposure to disaster or war or other hostilities. Z56, which Z56, 65, exposure to disaster, war, or other hostilities. Z65.8, other problem related to psychosocial circumstances. Personal history, which is Z91.82, personal history of military deployment. I admit to having thoughts of diagnosis in the vignette alone, considering Jake expressing that his old self died in Iraq. I did my research, though, however, and did come out to be right. He has been ignoring a lot of symptoms that he was experiencing over the last 10 months, so we're going to jump right into exactly which criteria he fits, because otherwise this will be a long it needs to be. Jake Levy has had exposure to actual or threatened death and serious injury directly, as himself has sustained an injury to his hand, which they talk about. Jake has been experiencing the following criteria: PTSD for 10 months. Jake is not wanting to engage with his family and friends. He is calling in sick to work a lot as well. He's also drinking 10 to 8 per day as well. 4 to 6 per day, and then 8 to 10 per weekend. Jake is not wanting to engage with family and friends and whatnot. He has persistent inability to experience positive emotions. So we're going to get into that. A1, direct experience. Criteria A1, criteria A2, witnessing trauma in person. B1, recurrent involuntary distressing memories. B2, recurrent distressing dreams of the traumatic experience. B4, intense or prolonged psychological distress at dreams of the traumatic experience. B4, intense or prolonged psychological distress with exposures to internal or external cues that symbolize or resemble an aspect of the traumatic event. B5, marked physiological reactions to reminders of the traumatic event. C2, avoidance of or efforts to avoid people, conversations, or interpersonal situations that arouse recollection of the traumatic event. C3, substantially increased frequency of negative emotional states, including fear, guilt, sadness, shame, depression, confusion. C4, markedly diminished interest or participation in significant activities, including constriction of play. C5, socially withdrawn behavior. C6, persistent reduction in expression of positive emotions. Alterations in arousal and reactivity associated with traumatic events, beginning or worsening after the traumatic events occurred, is evidenced by 2 or more of the following. He has D1, irritable behavior and angry outbursts with little or no provocation, typically expressed as verbal or physical aggression towards people or objects. D2, hypervigilance. D3, exaggerated startle response. D4, problems with concentration, sleep disturbance. The duration of this disturbance is more than 1 month. He's been experiencing 10 months. The disturbance causes clinically significant distress or impairments in relationship with parents, siblings, peers, or other caregivers, or with school behavior, work behavior. He has been going to work, and with his children, he's startled at them when they sneak up on him and whatnot, and he's not engaging with them. Disturbance is not attributable to the physiological effects of a substance. Alcohol is a sedative. It would not cause the type of distressors that he's been showing or have him meet the criteria. PTSD, I would treat that with cognitive behavior therapy paired with eye movement desensitization and reprocessing, EMDR. It's been successfully used to treat PTSD and co-occurring disorders as well, simultaneously. I value transparency with clients and believe Jake would respond well because of his military background to the straightforward approach of sessions. I would start by letting him know that there is nothing that can take away what he has endured in war, yet if he is here because those experiences are keeping him from living the way he is capable of, what we are going to work on is how he responds to those events. I would be upfront about our goals. I would use his strengths to assist him in overcoming his fears. Medical issues that Jake faces is his hand. He had wounded his left hand in combat in Iraq, and at times his limited ability to use his hand. He drinks increasingly large rate at 4 to 5 drinks a week. for weeknights and 8 to 10 on weekend nights. Jake states that drinking is the only time that he is not having to muster all of his strength just to fight off intrusive thoughts. Obviously, that's an issue. I believe that many veterans return not wanting to seek treatment and feel they need to just suck it up and finding themselves in maladaptive coping mechanisms that only make their suffering worse and give them multi-directional issues with the addiction of drugs, alcohol, or both. Alcohol as a sedative is an easy go for PTSD as it minimizes the anxiety. Yet with tolerance comes a need to increase the amount of alcohol in order to keep the intrusive memories out, and in most cases, strong desire to increase alcohol intake to do away with the memories as much as possible. Jake does not appear to be open with his wife about what he has experienced, which is common because most suffer with PTSD want to avoid the topic. Jake could benefit from participating in a PTSD AA veterans group, EMDR treatment pair, where he does not have to participate until he is ready. Yet there are men there to talk about what they have been through, and some of the experience will be much more likely to be similar with Jake and whatnot. Jake's wife may benefit from a support group for women who have husbands who are experiencing PTSD, so she can learn how to support her husband, understand that she is not alone, and help her children understand how to support dad as well through these issues. This is a lot longer on paper. I have so much more to add, but I am over 6 minutes now, and I just want to give you what I have. All right. Thank you very much. Bye-bye.